Preoperative phase. What is preoperative phase? So this phase begins when the decision for surgical intervention is made and ends with the transfer of the client to the operating room bed. During preoperative phase, nursing activities range from a baseline assessment of the client during the preoperative interview and at the clinic or at home, and continues with assessment in the preoperative area or surgical suite on the day of surgery. Remember that careful preparation of individuals undergoing surgery during the preoperative period decreases operative risk and promotes post-operative recovery. On the other hand, in the case of emergency surgery, time may not permit complete preoperative assessment, care planning, and teaching. Nevertheless, essential preparation must be thorough. Generally, preoperative preparation can take place in any of the four phases. Number 1, in the physician's office before admission to the healthcare facility. Number 2, on admission and during the day before operation. Number 3, the night before surgery if the client is in the hospital. Number 4, the morning of surgery on admission. During this phase, the nurse begins a complete assessment and establishes a plan of care based on individual physical and psychosocial needs. Remember, preoperative care focuses on preoperative teaching of the client and the family to reduce anxiety and decrease post-operative complications.
The role of the nurse is vital in general preoperative preparation. Each client responds differently to surgery. Many variables influence a person's physiologic and psychological responses to surgical experience. This includes the physical and mental status of the client, the extent of the disease, the magnitude of the surgery, the social financial resources of the client undergoing surgery, and the psychological and physiologic preparation for surgery. When considered collectively, these variables reveal the degree of risk for a client undergoing surgery. Therefore, nursing assessments includes all these factors.
Physiologic nursing assessment of the client. Preoperative nursing assessment includes the age, the allergies of the patient, the vital signs, the nutritional status, the habits affecting tolerance to anesthesia, the presence of infections, the use of drugs that are contraindicated prior to surgery, the physiologic status of the patient, the psychological status of the patient. The psychologic nursing assessment of the client before surgery includes information about the age, the presence of the pain, the nutritional status of the patient, the fluid and the electrolyte balance, the presence of the infection, the cardiovascular function, pulmonary function, the liver function, the gastrointestinal function of the patient, the liver function, the endocrine function, the neurologic function, the hematologic function, the medication history, the presence of trauma, and the health habits of the patient, lastly, the social history. Client preparation for surgery. First, we have to get an operative consent. Second, preoperative learning needs. Third, interventions the day or evening prior to surgery. And intervention the day of surgery. Preoperative consent is a legal preparation for surgery. It must be an informed consent. Informed consent, an active shared decision-making process between the provider and the recipients of care. Informed consent has three components. first is an adequate disclosure, the understanding and the comprehensive and the voluntary consent. Who can give consent? Of course, the patient and the spouse, the adult child, the parent, and the sibling. So, it can only be designated with a durable power of the attorney. Preoperative teaching. It includes deep breathing and the cupping exercises, the leg exercise or the ambulation, mobility and the active movement of the body, the pain control and medication, cognitive control to decrease anxiety and enhance relaxation, recovery room orientation, the probable post-operative theories, and the directions for the family. Deep breathing after surgery. Have the client sit upright at the side of the bed or supported in bed in semi-Fowler's position. Instruct the client to place his hands on the abdomen to feel whether the chest rises to indicate that the lungs are expanding. Third, have the client inhale through the nose until the abdomen distends. Fourth, instruct the client to exhale through pursed lips while contracting the abdominal muscles. Fifth, have the client repeat the exercise every hour during the first operative surgery.
Physical preparation. Preparing the skin. Usually, the operative area is cleansed the night prior to surgery with an aseptic such as povidone iodine to decrease the number of microorganisms on the skin. If shaving is necessary, it can be performed in the operating room prior to surgery. The nurse responsible for skin preparation should conduct a preoperative assessment for any skin abrasions, lacerations, or signs of infection of the operative area. Preparing the gastrointestinal tract. GIT needs a special preparation on the evening before surgery to reduce the possibility of vomiting and aspiration during anesthesia. Reduce the possibility of a bowel obstruction and to prevent contamination from fecal material during intestinal tract or bowel surgery. If a client undergoing a surgery is to receive a general anesthetic, foods and fluids are restricted for 8 to 10 hours before operation. When a client is in PO, explain the reasons, remove food and water from the bedside stand, place an NPO sign on the door and on the bed, mark the cardex NPO, inform the dietitian that the client is awaiting surgery, inform the other caretakers that the client is in PO. If the client who is in PO consumed foods or fluids, notify the surgeon because the surgery may be cancelled. Clients who are extremely malnourished or debilitated may receive IV infusions of glucose, amino acids, or plasma prior to surgery. Enemas are not routinely ordered during the preoperative period except for surgical procedures involving the gastrointestinal tract, perianal or perineal areas, and pelvic cavity. Gastrointestinal tubes are usually inserted during surgery, if they are to be used at all. This procedure is usually performed for clients undergoing major abdominal or intestinal tract surgery. Preparing for anesthesia. The anesthesiologist or nurse anesthetist visits the client before surgery to perform complete respiratory, cardiovascular, and urologic examination, promoting rest and sleep. The preoperative client will rest more completely at the night before surgery if he or she is physically comfortable, mentally at ease and adequately sedated. They still need to be encouraged to get as much sleep as possible before surgery. Encourage apprehensive clients to take ordered medication the night before the surgery. Always remember to talk in a positive manner with the client as you give preoperative care and listen to any doubts or fears the client may have concerning surgery.
Good morning, ma'am. Ako po si Roma Kabulit. Ako po yung nurse nyo na tutulungan ka and ready ka bago ka po dalhin sa surgery.
Continue to assess for signs of anxiety. Communicate any surgical delays to the client and significant others.
May question ka pa po, ma'am, or concern? Kinakabahan lang po. Okay.
Check the identification band to make sure it is legible and securely fastened to the client. Take and record vital signs.
Ano po yung last nyo nakain? Mga kagabi ka po, ma'am. Alas 10 po kagabi.
Assist the client in donning a hospital gown, protective head cup, a strap, or anti-embolytic gauze if this item had been ordered. Ask the client with oral hygiene if necessary. Ask the client to void dentures, bridge work that could obstruct the airway if left in place. Have the client remove jewelries. Remove colored nail polish and makeup so skin color can be observed. If the client is wearing making aid, notify the operating room nurse. Check for carry-out special orders like administering enemas, starting an IV lines, and give any preoperative medication. Note the time the patient leaves the floor to prevent omission in preoperative nursing interventions. Most facilities supply nurses with a protective checklist.
Transporting the client to surgery. When surgical personnel call for the client, gently transfer the client to a stretcher. Make sure you have enough help to transfer the client safely. Cover the client with blanket for protection, then secure with a restraining belt. Make sure the client record accompanies the client to the operating room. Make the trip to the surgery as smooth as possible so the sedated client does not develop nausea and dizziness. Avoid rapid walking and swinging the car around corners. The nursing unit should prepare the client room for post-operative care. Arrange furniture so the stretcher can easily be brought to the bedside. Make a surgical bed, set out an emesis basin, bring an additional equipment such as blood pressure cuff, IV stand, suction, and oxygen equipment as anticipated. Ensure that the equipment is in working order. Caring for significant others. Ask phone numbers where they can be reached. When discussing surgery with significant others, be aware of information previously given by the surgeon regarding the immediate surgical outcomes and eventual progress. Prepare them for nasogastric tubes, chest tubes, suction equipment, IV infusion, dressing, or a monitoring equipment the client might require. Reassure significant others that the length of the time the client is gone may not reflect the actual length of surgery.